So thank you. Your first name?
My name is Antonia. I'm from the Australian Breastfeeding Association. I have two questions. My first is very short, so I hope I might be able to ask both. The New South Wales Statewide Breastfeeding and Infant Nutrition Reference Group is a committee that was informed by the New South Wales Ministry of Health breastfeeding policy. That policy states that the Statewide Breastfeeding and Infant Nutrition Reference Group will continue to function with membership from the New South Wales Department of Health, local health districts, population health services and key external stakeholders to support policy implementation and encourage collaboration and coordination of effort. I'd like to bring to attention of the panel that the reference group has not met in the last 12 months, in over 12 months. Could the Minister please give an update on the status and future plans for this group?
Thank you for that. One of the things that we have done is, you would recall that out of the Garling report there was a recommendation of establishment of New South Wales Kids. The former government merged the two tertiary children's hospitals in Sydney, Westmead and Randwick as an outcome, but there were no other formal arrangements made regarding his recommendation. I have appointed now, in recognition of the gaps that created, I asked a group to come forward with some recommendations. That's led to the formation of New South Wales Kids and Families, which is looking at the whole of paediatric care, also in recognition of the important role that mothers parents make to the child before even birth, and in early years we've put in families. And I'll ask that we've just now established that and got a chief executive there, only appointed in the last couple of weeks. I'll ask them to reconvene and to meet with you. So thank you for raising that.
Thank you very much. So my second question is really regarding funding of the Australian Breastfeeding Association's New South Wales branch. You probably know about the work of the association and that we provide evidence-based support to New South Wales community, including families, health services and health professionals, and the support and implementation of the New South Wales Ministry of Health and Breastfeeding policy, which is the reason for my previous question. The NGO task force snapshot that was undertaken just a few weeks ago identified that the New South Wales branch had 7,000 occasions of service in just 1 week, which included over 400 calls taken to the breastfeeding helpline. The New South Wales ABA has over 500 volunteers and less than 3 New South Wales equivalent full-time staff. Last year, the Minister announced a funding of a $100,000 NGO grant to the ABA for 3 years and a 12-month project of $140,000 last financial year. The project funding was expended during the timeframe and a full report was submitted for the project. A further application was submitted for the project for the 2012-13 year, but there's been no response from the Ministry of Health to this application, nor has there been a response to any of our correspondence to the Ministry in the last 6 weeks. The ABA is now in a position of reduction of funding this year of $140,000, and it's impossible to maintain our current services on the $100,000 NGO grant and the $31,000 provided through Western Sydney Local Health District. Whilst it's understood that the NGO... Thank you.
Yes, look, whoops, she's taking the microphone with her. Look, for those in the room from NGOs, you will know we are reviewing NGO grants. And as I've said to the, I'm sorry, I've forgotten your name, the woman from the Transport Service, it is being evaluated on criteria of outcomes. So in the things that you've described there, I would reckon that you're pretty able to demonstrate the value in the investment in the service. I'm sorry you haven't been contacted by the Ministry. There's been a whole process of that happening. We've got somebody engaged going around talking to individual organisations, whether it's that person or whether it's New South Wales Kids and Families. I'll give an undertaking that will come to you. I was under the impression that all of those programs were being continued the funding until the end of the financial year, but let us take that on board.